Okay, let's unpack this. We've got this fascinating stack of sources here, pulling together insights on something we see our furry friends do all the time, but maybe don't truly understand. Those sudden, sometimes dramatic, involuntary actions involving their airways, things like sneezing, reverse sneezing, and gagging.
That's right. And these aren't just random noises. What's fascinating is how the sources describe these as incredibly important built-in protective mechanisms for animals, um, basically safeguarding their airways.
Exactly. So the mission for this deep dive is to really get into these three distinct reflexes. We'll figure out what makes each one unique, why they happen, what they might mean for your pet's health, and most importantly, how you can tell them apart. Think of it as your guide to decoding your pet's sudden snorts, honks, and retches.
And the sources make it clear these actions are involuntary, meaning the animal isn't choosing to do them. They're automatic responses controlled by uh, complex neural pathways.
Right.
Their primary purpose across the board is to protect the airway and the lungs from anything irritating,
Yeah.
irritants, foreign material, or even pathogens.
So the body has these automatic defense systems that just react.
Precisely. It starts with sensory receptors in different parts of the respiratory tract, detecting something that shouldn't be there or is causing irritation.
Okay.
They send signals to a processing center, primarily located in the brainstem. You can think of this as the body's reflex control hub. That brainstem then triggers a coordinated set of muscle contractions designed to deal with the problem.
Got it. Like the body's security system for the airway. Let's start with the one most familiar to us, sneezing.
Ah, the sternatory reflex, yes.
Yeah.
The sources define sneezing as a forceful, involuntary expulsion of air from the lungs, primarily directed through the nose, though, some air escapes the mouth as well.
And its job is pretty straightforward.
Its core job is to clear irritants, foreign bodies, or excessive secretions directly from the nasal passages. It's pushing things out.
So how does the body generate that explosive achoo? What's the mechanism?
Well, the sources break down the mechanics.
Mm-hmm.
First, the animal takes a deep breath to fill the lungs with air. Then the glottis, that's the opening to the windpipe, momentarily closes while the muscles used for exhaling contract forcefully. This builds up high pressure in the chest and airways.
Okay.
Suddenly, the glottis opens and the air is violently expelled. And here's a key point for differentiating it. During a sneeze, the soft palate, that soft flap at the back of the roof of the mouth, elevates.
Oh.
This action directs the bulk of that forceful airflow specifically through the nasal passages, effectively blowing out whatever triggered the sneeze.
So the soft palate direction is what makes it a sneeze?
Yes, it channels the power nasally. The trigger comes from those sensory receptors we mentioned, specifically mechanoreceptors and chemoreceptors sensitive to touch or chemicals located in the lining of the nasal passages.
Mm-hmm.
They send signals primarily via the trigeminal nerve, which is a major nerve of the face, back to that processing center in the medulla within the brainstem.
Okay, the how makes sense for clearing the nose. What kinds of things actually trigger a sneeze? What should you look out for?
Well, the sources list a range of triggers. For sudden acute sneezing, the most common culprits are simple environmental irritants like dust, pollen, smoke, or strong smells like pepper or cleaning chemicals.
Okay. The usual suspects.
Right. However, one really important insight from the sources for owners is the difference between dogs and cats for acute sneezing.
Oh.
In dogs, that sudden violent sneezing is often caused by a foreign body stuck in the nose, like a grass awn sniffed up outdoors.
Ouch. Yeah.
For cats, acute sneezing is much more frequently associated with acute viral infections, particularly feline herpes virus or calicivirus, which could then lead to secondary bacterial infections.
That distinction is helpful. What about sneezing that's chronic or keeps coming back? That seems more worrying.
Yeah, that points to more persistent issues.
Mm-hmm.
We look at chronic rhinitis or sinusitis inflammation in the nasal passages or sinuses, which could be due to allergies, an unknown cause, which we call idiopathic, or fungal infections.
Fungal, like mold. Sort of. Aspergillus is a common fungal culprit in dogs, while Cryptococcus is seen more in cats. A foreign body might also be persistently lodged if it didn't come out initially. Nasal polyps, which are non-cancerous growths, are relatively common causes of chronic sneezing, especially in cats.
And more serious causes, I guess that's always a worry.
Yes, unfortunately, persistent sneezing can be a sign of nasal tumors, such as carcinomas, sarcomas, or lymphomas.
Okay.
Another surprising cause can be severe dental disease, particularly if it leads to oronasal fistulas, that's an abnormal opening between the mouth and the nasal cavity, or apical abscesses, those root infections that can push into the nasal sinus space.
Wow. dental problems causing sneezing.
It can happen. And then there are parasites like Pneumonisoids caninum, which are tiny nasal mites that can irritate the nasal passages in dogs.
Nasal mites. Wow, that's a wide range. So we know the sound of a sneeze, but what does it look like visually? How can you describe it? The sources describe it as sudden, explosive expiratory efforts. The animal usually keeps its mouth closed and often throws its head downward, sometimes quite forcefully, occasionally even hitting its nose on the ground.
Right.
Pay close attention if there's any associated nasal discharge and note what it looks like. Is it clear and watery, cloudy, thick, and pus-like, or does it contain blood?
Okay.
Also, see if the discharge is coming from one nostril or both, as that can sometimes help veterinarians localize the problem.
And if the sneezing is chronic or seems concerning, how is it evaluated? What's the process?
Well, a thorough history from you is absolutely crucial. How long has it been happening? How often? What makes it worse? Are there any other signs?
Makes sense.
A physical exam, including a careful look in the mouth, is the starting point. Depending on what's suspected, the diagnostic workup can involve procedures like rhinoscopy, where a tiny camera is used to look directly into the nasal passages.
Right, like an endoscopy for the nose.
Exactly. Nasal washes can collect cells or fluid for analysis. For chronic or suspicious cases, especially to rule out things like tumors or fungal infections, advanced imaging like CT scans or MRIs are often necessary because they provide detailed cross-sectional views of the complex nasal structures. Biopsy might also be needed to get a definitive diagnosis.
All right, sneezing covered that powerful push outwards. Now let's pivot to something that sounds completely different, that rapid inward gasp you mentioned, the reverse sneeze. The sources also call it the pharyngeal gag reflex or inspiratory paroxysmal respiration. That sounds complicated.
It does sound complicated, but the key distinction here is the direction of the air movement. Reverse sneezing is characterized by a rapid, noisy, involuntary inspiratory effort.
Inspiratory, so in.
Exactly. Instead of pushing air forcefully out, the animal is rapidly sucking air in. It produces sounds like snorts, gasps, or sometimes even harsh wheezes.
So it's an inward snort, not an outward blast.
Exactly. Its job is actually a form of aspiration reflex, not in a bad way, but in a way that helps. It's designed to dislodge an irritant located specifically in the nasopharynx or the caudal, or furthest back part of the nasal passages. The very back of the nose area. Right, by sucking it inwards, which is then often followed by swallowing to clear it away.
And how does the body create that inward gasp? What's the mechanism there?
It involves rapid, repeated contractions of the muscles used for inhaling, like the diaphragm, typically while the mouth is closed.
Okay.
There's often a spasm in the pharynx and larynx at the back of the throat, and the voice box that pulls air forcefully inwards. The trigger comes from sensory receptors, specifically located in the nasopharynx, and those caudal nasal passages, think the area right above and behind the soft palate, or the deepest parts of the nasal lining.
What kinds of things trigger this specific reaction then?
Well, the triggers can include things like postnasal drip from allergies or rhinitis irritating that area. Environmental irritants like dust, strong perfumes, smoke, or even sudden changes in temperature can set it off.
Ah, okay.
Episodes can also be triggered by simple things like excitement, eating, or drinking. Like sneezing, a foreign body can cause persistent reverse sneezing if it's lodged far back in the nasal passages or nasopharynx.
And anatomical issues, you mentioned those before.
Yes, an elongated soft palate is a significant cause, particularly in brachycephalic or short-nosed breeds like pugs, bulldogs, or boxers.
Right, those flatter-faced dogs.
Exactly. That long, soft palate can extend too far back and irritate the nasopharynx. Nasopharyngeal polyps, which are non-cancerous growths, are another cause, especially in cats. And sometimes it's just mild inflammation in the pharynx or larynx. Importantly, the sources highlight that reverse sneezing is often idiopathic, meaning no specific underlying cause is found. This is particularly common in small breed dogs, and in these cases, it's generally considered a benign, harmless condition.
So there's often nothing to worry about. Who is most prone to reverse sneezing then?
It's overwhelmingly a canine phenomenon. Dogs, especially small breeds and those brachycephalic breeds, are much more likely to do it than cats. It's quite rare in cats unless there's a clear anatomical issue like a polyp.
What does reverse sneezing actually look like when it's happening? Because owners often get really worried.
They do. Owners often describe it as sudden paroxysmal, meaning it comes in its noisy inspirations. The animal typically stands still, pulls its head back, extends its neck, keeps its mouth closed, and you might see the lips suck in slightly.
Yeah.
They can look quite worried or distressed during an episode, which is often why owners get concerned. But the key visual cue is the repeated, rapid, inward gasping or snorting effort. These episodes usually resolve on their own in seconds to maybe a minute.
And how do you tell it apart from a regular sneeze or, say, choking? That's the big fear.
The absolute key distinction is the direction of the air. Sneezing is a forceful push-out. Reverse sneezing is a forceful pull-in.
In versus out. Got it.
Right. The sound is also different. Sneezing is a sharp achoo, while reverse sneezing is those rapid snorting or gasping sounds. Owners frequently confuse it with choking, where something is physically blocking the airway, or sometimes even asthma in cats.
Okay.
But true choking is a constant panicked struggle for air, often silent or with distressed vocalizations, not these rapid, self-limiting inward snorts.
If it's often benign, does it always require a vet visit? When should you actually worry?
Good question. The sources suggest that if the episodes are infrequent, brief, and the animal is completely normal otherwise, it's often self-limiting and generally doesn't require specific investigation.
Okay.
However, if the reverse sneezing is frequent, prolonged, or accompanied by other concerning signs like nasal discharge, bleeding, difficulty breathing when not having an episode, appetite loss, or lethargy, then it's important to investigate for those underlying causes we discussed. Evaluation might involve a thorough physical exam, including looking in the mouth and pharynx, potentially under sedation for a better view, or occasionally that nasopharyngoscopy to visualize the back of the nasal passages and nasopharynx.
Is there anything an owner can do during an episode to try and help stop it? Or do you just wait it out?
Well, you mostly wait it out, but the sources mention a couple of simple maneuvers that sometimes help, mainly by prompting the animal to swallow, which can interrupt the reflex.
Oh, okay.
Gently stroking the throat or briefly and gently covering the nostrils can sometimes encourage a swallow and stop the episode quicker.
Okay, gentle stroking, covered the nostrils maybe. Good tips. Let's move on to the third reflex in our deep dive. Gagging. The sources also refer to it as the pharyngeal reflex or sometimes retching.
Right. Gagging is described as a strong, involuntary contraction involving muscles in the pharynx, the back of the throat, the larynx, the voice box, and the abdomen. It's often accompanied by those characteristic retching motions.
Its job sounds a bit broader than the others, maybe involving more than just the airway. Seems like it could be stomach-related, too.
It is broader, you're right. It's a crucial protective reflex with several roles. It's primarily aimed at expelling material from the pharynx or potentially initiating the expulsion of material from the stomach. Think of it as trying to clear something from the throat or prepare to vomit.
Okay.
It protects against aspiration, meaning accidentally inhaling foreign material into the lungs. It also helps clear secretions from the larynx, the upper part of the trachea, windpipe, pharynx, or even the esophagus.
How does the mechanism of gagging work then? It sounds complex.
It's a coordinated effort of various muscle groups. It can be the initial stage before vomiting occurs, which is the retching part, or it can be purely an attempt to dislodge something physically stuck in the pharynx or esophagus. Sometimes the larynx will go into spasm as part of this reflex to protect the airway opening. The triggers come from sensory receptors located in the pharynx, the back of the tongue, the soft palate, the tonsils, and potentially extending down into the esophagus and stomach.
Wow.
These signals travel via major nerves, like the vagal and glossopharyngeal nerves, back to the medulla in the brainstem, connecting with both the vomiting and swallowing control centers.
So it really links the respiratory system, the oral cavity, and the gastrointestinal system. That explains why the causes seem so varied. What are the causes of gagging?
The sources list a wide variety, and yes, some are emergencies. Foreign bodies lodged in the pharynx, larynx, or esophagus are a major concern, things like pieces of bone, sticks, or toys.
That sounds like an immediate vet trip.
Absolutely. That's something that requires immediate veterinary attention. Inflammation in the throat area, such as pharyngitis, laryngitis, or tonsillitis, can also trigger gagging.
And anatomical issues like with reverse sneezing, can they cause gagging too?
Yes, that elongated soft palate in brachycephalic breeds can cause chronic irritation to the larynx, leading to gagging, snorting noises, and distress, especially during excitement or when they get hot.
Right.
Esophageal diseases like esophagitis, inflammation, megaesophagus, an enlarged floppy esophagus that can't move food properly, strictures, narrowing, or foreign bodies stuck in the esophagus can all manifest as gagging because the animal is trying to dislodge something or reacting to irritation lower down.
You mentioned earlier that coughing from heart issues can sometimes look like gagging. Can you explain that connection a bit more?
Absolutely. The sources note that coughing caused by underlying heart disease, things like an enlarged heart, cardiomegaly, fluid buildup in the lungs, pulmonary edema, or specifically an enlarged left atrium of the heart pressing on the left mainstem bronchus, which is a major airway tube.
Okay.
That kind of cough could be confused with or even trigger gagging. The effort of a severe cardiac cough sometimes ends with a sound or action that looks like gagging or retching.
So a heart cough can end in a gag. Interesting. Other cough-related causes.
Yeah, severe fits of coughing from conditions like tracheal collapse, where the windpipe temporarily narrows, can also end with a gagging sound.
Ah, okay.
Similarly, the classic dry honking cough of infectious tracheobronchitis, or kennel cough, is frequently followed by a gagging or retching noise as the animal tries to clear the irritation.
What about secretions or drainage, like postnasal drip?
Yes, excessive postnasal drip from the nasal passages or nasopharynx, especially if it's thick or irritating, can drip down the back of the throat and trigger a gag reflex.
Makes sense.
Also, if an animal has coughed up secretions from further down in the lower airways into the larynx or trachea, that material can stimulate gagging as the body tries to clear it upwards.
Right.
In cases of pharyngeal or laryngeal dysfunction where there's a loss of sensation or ability to move these structures normally, material can build up or even be aspirated into the airway, triggering gagging. And finally, masses or tumors located in the pharynx, larynx, or the upper part of the esophagus are also potential causes, the sources mention.
That really covers a lot of ground. What does gagging actually look like, especially compared to vomiting? How can you tell the difference?
It involves those characteristic retching motions and deep, visible contractions of the abdominal muscles. The animal's mouth is usually held open, and they often extend their head and neck forward.
Okay.
You might see drooling or repeated attempts to swallow. The key differentiator from true vomiting is that with gagging, there's usually little to no material actually expelled from the mouth beyond maybe some saliva or froth.
Ah, so retching without actually bringing much up.
Exactly. With vomiting, you see stomach contents expelled. Owners frequently confuse the retching motions of gagging with actual vomiting.
And how is gagging evaluated given the wide range of potential causes? Where do you even start?
Because the potential causes involve so many different areas, evaluation starts with a very thorough history and physical exam, looking for any other signs like difficulty swallowing, trouble breathing, loss of appetite, pain, fever, or weight loss.
Right, the whole picture.
Exactly. The diagnostic workup will depend on the suspected cause. It can include a detailed oral exam, sometimes under sedation for a better view of the back of the throat. Radiographs, x-rays, of the neck and chest are often taken, possibly with contrast material swallowed to highlight the esophagus.
Like a barium swallow.
Something like that, yeah. Fluoroscopy, which is like a live x-ray movie, can be used to assess swallowing function and esophageal motility. Endoscopy is also common in pharyngoscopy. Pharyngoscopy, laryngoscopy, and esophagoscopy allow direct visualization of the throat, voice box, and esophagus.
Seeing inside is key.
It often is. Part of the evaluation might also involve assessing the presence and strength of the gag reflex itself, or using medications like doxapram to stimulate deeper breathing for a better look at the larynx.
Okay, so we've explored each reflex individually. Now let's pull it all together. How do we use this information to differentiate them and guide diagnosis? Because they can sound confusing.
They can, but the sources provide clear signposts for differentiation, and this is where your observation as an owner is paramount. To summarize the key distinctions, sneezing is that loud, sharp, forceful expulsion of air, primarily through the nose. Think outward and nasal discharge.
Outward blast. Got it.
Reverse sneezing is the rapid, short, repeated, noisy inspirations. The snorts or gasps, usually with the head pulled back and neck extended. Think inward and nasopharyngeal irritation.
Inward snorts. Okay.
Gagging involves the retching motions and deep abdominal contractions, usually open-mouthed, often with attempts to swallow but little expelled material. Think retching, throat, esophagus, stomach irritation, and often neck extended forward.
Retching, neck forward. So really paying attention to the sound, the direction of the air movement, the body posture, and whether any material comes out is crucial.
Absolutely critical. The sources emphasize that careful observation and an accurate history from you are invaluable. Veterinarians really appreciate it when owners can provide video recordings of the episode.
Oh, that's a good tip. Video it.
Definitely. Seeing the actual event can be much more informative than a verbal description alone in distinguishing between these reflexes.
And the diagnostic approach then follows from those observations, like a roadmap.
Exactly. Your description and the vet's initial exam help narrow down which reflex is happening and therefore which anatomical area is likely involved. Based on that, the diagnostic path is chosen.
Right.
For example, an acute, severe episode that looks like gagging, especially after the animal had access to something they shouldn't have, points strongly towards a foreign body and becomes an emergency requiring urgent imaging or endoscopy.
Okay, that makes sense.
Acute sneezing with nasal discharge might lead to looking for infections or irritants. Chronic sneezing leads to investigating deeper nasal issues with rhinoscopy, imaging, and biopsy.
Uh-huh.
Chronic reverse sneezing, especially in the common breeds, might initially be monitored, but if concerning, leads to examining the nasopharynx. And chronic gagging triggers that broader workup, looking at the pharynx, larynx, esophagus, heart, or trachea.
So standard blood tests aren't usually the first step for the reflex itself.
Correct. Routine lab tests like a CBC, chemistry, or urinalysis aren't specific to these reflexes themselves. They're more useful for assessing overall health or looking for systemic issues related to an underlying cause like infection or organ function changes.
Right.
The imaging and procedural diagnostics are key to visualizing and identifying the local cause triggering the reflex.
It sounds like treatment is always directed at whatever underlying issue is discovered then. No reflex suppressants.
That's precisely it. The sources are clear. Treatment is focused on the underlying cause. There isn't a magic pill that just stops these reflexes, because fundamentally they're protective. You don't want to stop them without knowing why they're happening.
Right. Makes sense. What are some examples of how finding the cause leads to treatment?
Well, if a foreign body, polyp, tumor, or abscessed tooth is found, the treatment is usually surgical removal.
Yeah.
Infections are treated with the appropriate medications, antibiotics for bacterial infections.
Oh.
The sources note gram-positive bacteria are more common in nasal infections, gram-negative in lower airways. Antifungals for conditions like aspergillus or cryptococcus. Anti-inflammatory medications like prednisolone or piroxicam might be used to reduce inflammation, but vets are careful with these, noting precautions, especially with piroxicam, in pets with kidney issues or if they're on other NSAIDs.
And those nasal mites you mentioned, how do you treat those?
Nasal mites, like pneumonicoids candidum in dogs, are treated with specific antiparasitic medications like ivermectin, silamectin, or milbemycin. It's important to be aware of breed sensitivities, like potential issues with ivermectin in collies and related breeds.
Right, the MDR1 gene thing.
Exactly. The sources even suggest that if chronic sneezing is present and no other cause is found, a trial treatment for nasal mites might be warranted, just in case.
Any other medical options, like for allergies?
For certain cases, particularly those suspected to have an allergic component or excessive secretions, decongestants, or antihistamines, might be tried, though their effectiveness can vary quite a bit.
What if the cause is anatomical, like that elongated soft palate? Surgery.
That often requires surgical correction, like shortening the soft palate. For gagging related to esophageal issues, management might involve simple changes like using elevated food and water bowls or altering the consistency of the food to make swallowing easier.
Okay.
Treating underlying heart disease is essential if a cardiac cough is triggering gagging. And if nausea is the primary cause of gagging, antiemetic medications, anti-sickness meds can help.
What about that common idiopathic reverse sneezing, the one that's often harmless?
For those benign cases where no specific cause is found, the main approach is reassurance for you, the owner, that it's harmless.
Which is huge.
It really is. And advising those simple maneuvers like throat massage or briefly covering the nostrils during an episode to try and interrupt it. Mostly just letting owners know it looks scary, but it's usually okay.
And if gagging is due to loss of sensation or function in the throat, increasing aspiration risk, that sounds serious.
It is serious. The sources indicate there's no specific treatment to restore the sensory or motor function itself in those cases. The focus shifts to management strategies to minimize the risk of aspiration pneumonia, such as using elevated bowls or altering food consistency. However, aspiration remains a serious concern. This is why the sources strongly emphasize that client education is key. Why? Helping you, the owner, understand the clear distinctions between sneezing, reverse sneezing, and gagging is vital because they are so frequently confused. We mentioned video recordings are incredibly helpful for the vet.
It sounds like empowering owners with accurate information is a big part of helping their pets. It reduces panic and helps them know when to act.
Absolutely. It helps you know when a reflex is typically benign and just something to monitor, like idiopathic reverse sneezing,
Hmm.
versus when it really signals a serious, potentially urgent problem. Knowing those emergency signs, things like severe difficulty breathing, even when not having an episode, blue or pale gums, persistent and severe gagging where they can't seem to clear anything, or excessive bleeding associated with a sneeze or gag warrants immediate veterinary attention. Don't wait on those.
Okay, good to know the red flags. And if it turns out to be a chronic condition?
Understanding that chronic conditions might require ongoing management is important. Explaining why diagnostic testing is necessary to pinpoint the cause helps owners understand the process and, the cost involved sometimes.
Yeah.
If the cause is infectious, simple precautions like limiting contact with other animals until treatment is effective are important. And preventive measures like proper dental care and trying to limit access to small objects or irritants that pets might inhale or swallow can help reduce the risk of some
Oh,
causes.
so these aren't just random noises or behaviors pets make. They're incredibly sophisticated protective systems. And understanding the subtle differences in how they look and sound and what triggers them really provides a map to figuring out what might be going on inside.
Precisely. This deep dive into sneezing, reverse sneezing, and gagging clearly shows us how closely linked these seemingly simple reflexes are to the animal's overall respiratory, oral, and even gastrointestinal health. It's all interconnected,
It really makes you appreciate how much pets communicate through these physical actions, even the involuntary ones. You just have to learn the language.
which, raises an important question. How much more could we understand about our animal companions if we simply paid closer, more informed attention to these seemingly simple signals they give us every day? What else are they trying to tell us through their bodies?